Hi, I'm Talia from Mashpee TV, and today we're here with Dr. Tager from the Community Health Center of Cape Cod, and he's going to sit down and answer a few questions about this new COVID-19 vaccine that all of us are desperately wanting to know about. So Dr. Tager, thank you so much for being here with us today.
Thank you for having me, Talia.
So can we just dive right into it, and can you just give us a little bit of background about vaccines and how does it work? What is a vaccine?
Sure. So a vaccine is something that works with the body's immune system to create a defense against a potential infectious organism. So the body has a system where the white blood cells respond to any kind of invader into the body, so to speak, and to recognize that as a foreign being and to attack it and destroy it. So when you get sick with a cold or whatever, you get a response to that because the body will recognize the fact that you've seen this cold before and say, aha, this is not part of what I am. It's a foreign substance, and destroy that virus. So the way vaccines work essentially is to give you immunity to something you have not seen before. So like COVID-19, which is a brand new organism. So nobody's been exposed to this before, so nobody has immunity to this. So the way the vaccine works is to work with the body's immune system. So the vaccine gives you a protein essentially into the body that the immune system then recognizes as being foreign. It's something that we have not seen before. And so when you get just the protein and not the virus itself, you don't get sick because the virus is not invading you. It's just a piece of that virus that's there, and it cannot produce the sickness. But it is enough to allow the immune system to recognize the virus if it does come into the body. So that then you develop this memory, your immune system develops a memory, so that once you've been vaccinated, you have immune cells that will recognize the virus, attack it, and prevent you from getting sick.
So you kind of answered the next question within itself, is the vaccine safe?
COVID-19 is such a brand new organism, and the rate at which the vaccine was developed was incredibly quickly. And I think a very impressive note to how well science can adjust on the fly here and develop things that we really need in a timely fashion. But the way the vaccines were developed, typically we see years of testing before are there any side effects? But they were able to gather a huge number of subjects to test the vaccine on. And the results are remarkably impressive, not only for safety, but also for efficacy. And I do think that at this point, it's a very safe vaccine, and I would encourage people to get it as soon as they can.
So what are some of the typical side effects from getting the COVID-19 vaccine that you've seen thus far, or they've discovered?
So the most common side effect is irritation at the vaccine site, and achiness in the arm, where you get some redness associated with that in a lot of people. The other side effects tend to be less so, but fatigue, which is similar to what the COVID virus itself does. Fatigue is probably the next most common thing, and then achiness, muscle aches, even a low-grade fever can be associated with the vaccine. So things that you would expect to see in a mild case of COVID, you could expect to see as a potential side effect from the vaccine. Usually much shorter lived, 24 to 48 hours for most of those side effects to go away and resolve on their own. People should take Tylenol or Motrin type thing, and stay well hydrated. But that would be typical. Most of the vaccines that we have now are the 2-dose vaccines. And typically it's after the second dose that you'll get most of those side effects, more so than after the first dose, because your body already then has some recognition of that protein. So you would expect the immune system to kick in a little more aggressively. And that's why you're feeling those side effects. It's your immune system working. So it's actually a good thing if you're having some of those mild side effects. So you know that the vaccine is actually stimulating that immune system to develop a response.
What happens after the first dose typically?
So the first vaccine typically gives you that local reaction. That's going to be the most common thing that you're going to see. It takes about 2 weeks for you to get any kind of significant immune response after you've received the vaccine. So those first 2 weeks, you should be considered not having any kind of immunity to the vaccine, just as you were prior to the vaccine. After about 2 weeks, the immune system does kick in, and the studies do show that you get about a 50 to 70% immune response. So that if you compare people who got a placebo or a fake dose versus people who get a single dose, they're 50 to 70% less likely to get infected with COVID if they were to be exposed. However, they should still wear masks, they should still social distance, they should still wash hands. That single dose is not effective enough to really presume that you've got immunity. So super important that you schedule the second dose and that you get the second dose as appropriate for whatever type of vaccine you get before you can have true immunity.
If you get the vaccine, that doesn't make you contagious to those who don't have the vaccine,
Correct,
right?
because you're not getting the virus. Remember, you're getting only a protein from that virus. So that does not make you infectious. That's exactly right. So, at home and stuff, people who you don't normally quarantine from, you don't have to do that with the vaccine. It does not mean you're infectious at all.
The community health center, how are they rolling out their vaccinations? Like, who's going to get it first? When are they starting it?
So this is all based on guidelines from the Massachusetts Department of Public Health. That's who allows us to get the vaccine. So we are currently in phase 1 of vaccine distribution. And for people who want more information, the Massachusetts Department of Public Health website is a great place to go look for information on when you might be ready to get the vaccine. But phase 1 initially has been healthcare workers. It has been anybody who might be COVID facing in the healthcare system. And it's moved on to first responders. It includes people who live in nursing homes or other settings where there's potential for a rapid spread, and people who might be particularly prone to getting very, very sick with the illness. Phase 1, we have already started. So the staff here at the health center has been vaccinated. Everybody who wanted it was able to receive a vaccine. And we are currently moving into getting the second dose of that vaccine for the staff here. So phase 1 is supposed to continue till about the beginning of February. And once that is taken care of, then we move into phase 2, which will be patients who are at higher risk for developing the disease. And the community health center will send in all the information to the Department of Public Health through a website. And once they have seen that we vaccinated all our staff and all the frontline workers and all those things, they will tell us, okay, you're ready to move into phase 2. And you will receive however many vaccines we will receive based on the population that we're going to be charged with vaccinating. So phase 2 hopefully will start the beginning of February. And that will include anybody over the age of 75 or anyone who's got 2 or more significant medical problems. And those include things like lung disease, heart disease, kidney disease, diabetes, any immunosuppressive disease. So anybody who's got any 2 or more of those significant illnesses might be at high risk for developing COVID. It will also include in stage 2, grocery store workers and other people who are considered frontline workers, but maybe not in healthcare, but who have been out there and required to get to work so that everybody can continue to get things that they need. So teachers among those will in the early education will be in that profile. Things along those lines. And then we go down the list and then vaccinate people who are 65 or older, or people who have 1 or more significant illness. And then ultimately we get to phase 3, which is the general public. So that's going to be everybody who doesn't necessarily fall into those other categories. And so hopefully that's going to start somewhere around April. And we'll see. A lot will depend on how the supply goes and how the distribution goes, but that's the plan at this point.
So how has the supply and demand been keeping up so far? Are you guys getting enough for phase 1 and keeping up with the amount of people that you're getting to get through phase 1 as far as vaccines?
Yes. So good question. We got an initial supply of, I think, about 300 doses for the staff here and for everybody that's affiliated with the health center who was in that COVID facing position and things like that. For vaccines that we have excess for, we've gone down the list as per the Department of Public Health, and we have been set to vaccinate home healthcare workers, such as the visiting nurses who need that, the people who are going into people's homes who are going to be potentially facing COVID-infected patients. We will also be working with the shelters in Falmouth to vaccinate that population. So once those 300 doses are gone, we will tell the state that that's the case, and we will ask for our next shipment so we can start phase 2. But we're really we have to stay within phase 1, and we've had enough vaccine for phase 1 at this point in time. That has not been an issue for us.
Is that just available for Mashpee, Cape Cod, your patients? How do people get vaccines through the community health center?
Right. So phase 2 will be primarily, it will be patients of the community health center who are primary care patients. And what I would recommend for patients who aren't our patients is that they contact their primary care provider to find out where it is that they can be getting those vaccines. So there's going to be a set distribution among community health centers, the hospitals on the Cape will be getting that. Some of the pharmacies will be the other place that, potentially you may be able to get this, depending on where we are in the phases and where the doses have been distributed to. But retail pharmacy should be part of the distribution process. I think part of the hang up in getting this out there is getting enough people who have the vaccine to be able to give to patients. So they're trying to get a lot of resources going so that there will be a lot of sites potentially. The other place to go to or consider that may be distributing vaccines will be the local departments of public health. They may be setting up clinics as well to distribute the vaccine to the population here on the Cape.
Is it expensive? Does health insurance usually cover it? Is that the case?
So the nice thing about the COVID vaccine is that the federal government is paying for everybody. Okay. So there is no copay. The vaccine is free for everybody. There may be some billing to insurance that goes through this, but the insurance companies have made it very clear in Massachusetts that they are not going to ask patients to pay out of pocket for any kind of money for this vaccine because it's so important. So really, there shouldn't be any issue with that. That should not be a barrier to getting this.
Awesome. And so a general question, I think, for a lot of people are wondering is, if someone has had COVID-19, are you still encouraging those people to get vaccinated?
An absolute yes on that. So good question, because that's come up a lot in questions from my patients personally. So the immunity that you get when you get a natural infection, when you're in the community and you get COVID-19, we believe lasts probably 90 days, 3 months, but it may be longer. This is such a new virus, we just don't know. We believe, however, that the vaccine will give you much longer immunity. So while you need to have recovered from the COVID, you need to be not having any COVID symptoms to come in for a vaccine. You absolutely should get a vaccine once you've totally cleared your symptoms from the COVID-19. Initially they were saying wait 90 days after the infection. That has changed so that it's simply, the recommendation now is simply you need to have cleared symptoms before you should get vaccinated for that.
And do you think this is something that's going to keep rolling out into the summer, into, like something that we're going to have to keep on getting, like the flu vaccine, or yes?
Well, that's actually that's unknown at this point in time, I would have to say, simply because it's such a new virus. Mm-hmm. And whether, how long the immunity lasts from the vaccine is going to be questionable. So, already that you've probably heard about these mutations that are occurring, and we're getting new forms of the virus circulating in the community. What happens with the flu is that every year you get new mutations, and so your vaccine from last year is not going to protect you from this year. Mm-hmm. So if COVID holds to that same pattern, yes, we may be talking about regular vaccines. I hope not. It may not be. It may be more like other viruses and things that we get vaccinated once in childhood for, and then you never have to do that again. But I think the data is just too soon. We just don't know yet the answer to that question.
Thank you so much. And was there anything else that you wanted to add about the vaccine or tell others about getting the vaccine?
I think that it's super important. I am strongly encouraging people to get it. I think there's a lot of fear in the community about this being such a new vaccine and what the side effects are and things along those lines. But I really see our only way out of this pandemic is to get the majority of people vaccinated. It's a safe vaccine. It's going to save lives. And I think as soon as it's available to you, you should make an appointment to get that done. Make sure you get your second dose because, as I said, you're not fully immune after the first dose. There is a website that the CDC has out called V-Safe. V is in the letter V, safe, S-A-F-E, which will prompt you to call in with any side effects. And it will also prompt you to have reminders about when you're due for your second dose, so you don't miss that second dose. So that's a great website to go to. I would strongly encourage that. But I really think that once we get the majority of people vaccinated, we're going to be on our way to getting back to some sense of normalcy again. And I look forward to that.
Yes. Well, thank you so much for taking the time today to answer all these questions. I know it's a lot, but I think a lot of people, like you said, are very questionable about it. And the more information that they have to formulate a decision, the better.
Yeah, I agree wholeheartedly. Thank you very much for having me, Talia.
Yeah, thank you so much. If you or anyone you know has any questions or concerns regarding the COVID-19 vaccine, when you're able to get it and where, you can visit the Massachusetts Department of Public Health informational site at www.mass.gov/COVID-19.